Eloise Macababad, student nurse from Medical Colleges of Northern Philippines. So today's video, I am going to perform an assessment for cranial nerve, which is the cranial nerve is provide information regarding to the transmission of the motor and sensory messages. So, good morning, ma'am. I am Eloise Macababad, student nurse from Medical Colleges of Northern Philippines, your nurse for today. So, ma'am, today I am going to assess your cranial nerve. Is that okay with you?
Yes.
So, what's your name, ma'am?
Via Faith Isabel B. Macabagdag na.
Your birthday po?
February 13, 2011 po.
So, now we are going to assess the cranial nerve number 1, which is the olfactory nerve, responsible for the sense of smell. So, ask the patient to clear out her nose. Can you please clear out your nose, ma'am?
Yes.
Then, ask the patient to close her eyes, observe one nostril, and ask the patient to identify the object that I'm going to let her smell. Okay, ma'am, so we are going to assess your sense of smell, and I want to close your eyes. I'm going to cover one of your nostrils, and please identify this object. Okay, ma'am, what is this?
Coffee.
Okay, the other one.
Soup.
Okay, great. So, the patient are able to identify the smell of the object. So, next will be the assessing the cranial nerve number 2, which is the optic nerve. Optic nerve are responsible for the sense of vision. So, first we are going to assess for the patient's visual acuity is the degree of detail that the eye can discern in an image. So, for this test, we are going to use a handheld card and ask the patient to read what is written in the handheld card. Okay, now, ma'am, I want you to read these numbers for me.
1, 3, 9, 8, 2, 5, 7, 6, 3, 4.
Okay, so great. So the patient are able to read those numbers written in a handheld card. So now we are going to assess for patient's vision field. Okay, ma'am, I want you to look at me straight in the eye. So I'm going to place my fingers here. Tell me whenever you see them entering your visuals. Okay, now we are going to assess for cranial nerves number 3, 4, and 6. Ask the patient to look directly at my eye. Okay, so I am inspecting the upper eyelids. Upper eyelids should not obscure vision. Okay, I'm observing for pupils. Pupils should be round and equal in size. Now, assess for papillary reaction. Observe for the direct and consensual response. Okay, ma'am, I am going to shine a light on your eyes. Okay, just look straight into my eyes. So, next, I am going to hold out my finger like this. Ma'am, I want you to look at my finger first and then spot on the wall. So, ma'am, I want you to follow my finger using your eyes only. Do not move your neck, just your eyes only, okay?
Yes.
Okay, pupils are equally round, reactive to light and accommodation. Okay, so now we are going to assess for the cranial nerve number 5, which is the trigeminal nerve. So now I am going to assess for the light touch sensation. I am going to use a cotton. I want you to close your eyes and say whenever you feel the cotton touching your skin, okay?
Okay. Soft. 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 Soft.
Okay. So now I am going to compare both sides. I want you to tell me if the feelings is the same or not.
Soft, 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 soft.
Okay, great. So now I am going to assess or test your corneal reflex. I want you to look up into that side with your eyes only. Do not move your neck. Look up at the left side, please. Okay. A normal patient would blink and tear in her corneal reflex test. So now we are going to assess the cranial nerve number 7, which is the facial nerve. Okay, ma'am, I need you now to perform some facial expressions. Can you please smile? I want you to frown. Now show your teeth. Okay, now pop your cheeks. Okay, relax your face. Pout your lips. I want you to close your eyes tightly. I can open it. So normally a person can do these maneuvers easily. So now we are going to assess the cranial nerve number 8, which is the vestibulocochlear nerve. So first we are going to perform the whisper test. So ma'am, we are now assess your hearing. I want you to close your eyes. I am going to cover one of your ears and whisper something on the other side. I want you to repeat it loudly, okay?
I am beautiful.
Okay, the other side.
I am beautiful.
So now we are going to perform the Weber's test, okay? Do you hear that sound?
Yes.
So now we are going to perform the rinse test. Okay, do you hear that sound?
Yes.
Okay, do you hear that sound?
Yes.
Okay, so normally a patient hear the sound longer in the ear than the bone. So now we are going to assess the cranial nerve number 9 and 10, which is the glossopharyngeal nerve and the vagus nerve. Yeah. So now I am going to assess the insides of your mouth. I want you to say ah. Now we are going to test for the patient's gag reflex. I will be poking the back of your throat. Is that okay with you?
Yes, ma'am.
So in this test, you should see the soft palate. So now we are going to assess the cranial nerve number 11, which is the accessory nerve. So first we have to expose the trapezius muscle. Can you please shuffle your shoulders and hold it, please? Okay, done. So assess for the strength and the contraction. Now I want you to move your head against my hand, please. Assess for the force and contraction of the external hydromuscular muscles. Now we are going to assess the last cranial nerve, which is the cranial nerve number 12, which is the hypoglossal nerve. So now, going to assess for your tongue, ma'am. Can you please open your mouth? Assess for any atrophy or vagus tension in the tongue, your tongue. Observe for any asymmetry or deviations from midline. Can you close your mouth now? Okay, thank you. So the tongue should be protruding outward. So that ends our cranial nerve examination. Thank you so much, Ma'am Ria.